Hello everyone and welcome to Know Your Drug, the ultimate destination for all things of health and wellness from the fascinating world of pharmaceuticals. We are here to guide you on Clobazam Tablet, exploring the various aspects of clobazam, their usage, dosage, mechanism of action, side effects, and most importantly, essential advice for taking them safely and responsibly. Before we begin, let me emphasize that the content provided in this channel is purely educational. Always consult a healthcare professional for personalized advice regarding medications. Now, let's get started. Use of Clobazam tablet. Clobazam is a medication that belongs to the class of drugs known as benzodiazepines. It is commonly prescribed for the treatment of various conditions, primarily epilepsy and anxiety disorders. Here's a brief overview of its uses. For epilepsy, clobazam is often prescribed as an adjunctive treatment for certain types of epilepsy, particularly for Lennox-Gastaut syndrome, a severe form of epilepsy that usually starts in childhood. It helps reduce the frequency and severity of seizures. For anxiety disorders, clobazam may be used in the short-term treatment such as generalized anxiety disorder. It has a calming effect on the central nervous system and can help alleviate symptoms of anxiety. For muscle spasms, clobazam may also be prescribed to manage involuntary muscle movements that can occur due to various conditions, such as cerebral palsy. Dosage of Clobazam tablet. The dosage of clobazam can vary depending on the specific condition being treated, the patient's age, weight, and individual response to the medication. Below are general guidelines for clobazam dosages for different conditions. In treatment of epilepsy, the initial dose for adults and children 2 years and older is typically around 5 to 10 milligrams per day, divided into 2 or 3 doses. The usual maintenance dose is between 20 to 40 milligrams per day, again divided into multiple doses. In treatment of anxiety disorders, the typical starting dose for adults is 5 milligrams, taken 2 times per day. Your doctor may increase or decrease the dose gradually if needed, based on your individual response. The maximum recommended dose for anxiety disorders is often around 20 milligrams per day. In treatment of muscle spasms, the dosage can vary widely depending on the individual and the severity of the spasms. The usual starting dose for adults is around 20 milligrams per day, divided into 2 or 3 doses. Mechanism of action of clobazam tablet. Clobazam is a benzodiazepine medication, and its mechanism of action is primarily centered on its interaction with a neurotransmitter in the brain known as gamma-aminobutyric acid. GABA is an inhibitory neurotransmitter that helps regulate the excitability of nerve cells in the brain. Benzodiazepines like clobazam enhance the effects of GABA, leading to a calming and sedative effect on the central nervous system. Here's a more detailed explanation of the mechanism of action. Enhancement of GABA activity. Benzodiazepines, including clobazam, bind to specific sites on GABA receptors in the brain. These receptors are called GABA receptors. When benzodiazepines attach to these receptors, they enhance the inhibitory actions of GABA. GABA normally reduces the activity of nerve cells by allowing negatively charged chloride ions to enter the cells, leading to a decrease in their firing rate. The enhanced effect of GABA due to benzodiazepine binding results in increased inhibition of nerve cell activity. Neuronal hyperpolarization. The activation of GABA receptors by benzodiazepines leads to an influx of chloride ions into the nerve cells. This influx causes the cells to become more negatively charged, a state known as hyperpolarization. Hyperpolarization makes it more difficult for nerve cells to generate action potentials, electrical signals, effectively reducing their excitability. This contributes to the calming and sedative effects of clobazam. Anxiolytic and anticonvulsant effects. The increased inhibitory activity in the brain due to enhanced GABA function results in reduced anxiety and a lowered risk of seizures. This is why clobazam is used in the treatment of anxiety disorders and epilepsy. Side effects of clobazam tablet. Clobazam, like other benzodiazepine medications, can have a range of potential side effects. Here are some common side effects associated with clobazam. The common side effects are drowsiness, sedation, fatigue, dizziness, impaired coordination, headache, memory problems, increased saliva production, nausea, constipation. The less common side effects are behavioral changes, like agitation, irritability, aggression, mood changes, restlessness, tremors or shaking, blurred vision, changes in appetite, skin rash or itching, difficulty breathing, swelling of the face, lips or tongue. The serious side effects are severe drowsiness or confusion, difficulty breathing or swallowing, hallucinations or delusions, severe skin reactions such as Stevens-Johnson syndrome. Remember that this list is not exhaustive, and side effects can vary. Your doctor will have a more comprehensive list of potential side effects based on your individual health status and other factors. Important advices for using Clobazam tablet. When using Clobazam tablets, it's important to follow your healthcare provider's instructions carefully and be aware of certain important advice to ensure safe and effective use of the medication. Here are some key pieces of advice to consider. Take Clobazam exactly as prescribed by your doctor. Follow the recommended dosage, frequency, and duration of treatment. Do not adjust the dose or stop taking the medication without consulting your healthcare provider. Alcohol can enhance the sedative effects of Clobazam and increase the risk of side effects. Avoid alcohol while taking this medication. Clobazam can cause drowsiness, dizziness, and impaired coordination. Avoid activities that require mental alertness, such as driving or operating heavy machinery, until you know how the medication affects you. Inform your doctor and pharmacist about all other medications, supplements, and herbal products you are taking. Clobazam can interact with certain drugs, including other central nervous system depressants, and lead to increased sedation. Provide your healthcare provider with your complete medical history, including any past or current conditions such as liver problems, kidney problems, respiratory issues, or a history of substance abuse. If you are pregnant, planning to become pregnant, or breastfeeding, discuss the potential risks and benefits of Clobazam with your doctor. Benzodiazepines can have effects on the developing fetus or newborn. Clobazam can lead to tolerance, needing higher doses for the same effect, and physical dependence. Do not stop taking the medication suddenly, as it can lead to withdrawal symptoms. If you and your doctor decide to discontinue Clobazam, a gradual tapering schedule may be recommended. Grapefruit and grapefruit juice can interact with Clobazam and affect how the medication is metabolized in your body. Talk to your doctor about consuming grapefruit products. Store Clobazam tablets at the recommended temperature and away from moisture and direct sunlight. Keep them out of reach of children and pets. In case of an overdose or adverse reaction, contact emergency medical services or a poison control center immediately. Attend all scheduled medical appointments to monitor your progress and discuss any concerns with your healthcare provider. By the end of this video, you'll have a solid understanding of the use, dosage, mechanism of action, side effects, and important advice for taking Clobazam tablet. Remember, knowledge is power, and being well informed empowers you to make the best decisions for your health.